To be added on. It's an honor to be here with Dr. Zhang. I know many of you know that who Dr. Zhang is. Dr. Zhang is a medical doctor, but is a modern Chinese integrative practitioner, combining the East and the West and acknowledging the importance of the integration of both. But there's a big concentration on herbology, on herbs, and I was privileged to go to him with Lyme, oh my God, a long time ago, and I refused a lot of the more serious medical treatment, and I'm lucky that it worked for me. And what we're gonna talk about really, and the most important thing is prevention, COVID treatment, post-COVID treatment, but we're living in a world with Lyme and tons of pathogens and Corona and COVID. So all of Dr. Zhang's studies and all of his products are relatable to all these different areas. So anyway, welcome Dr. Zhang, and thank you for being here.
Okay, this is my second time to talk to you. I think that before we just very general talk about how we deal with Lyme disease and how to deal with this COVID-19 infection. So if you have any question about this condition, both of Lyme and also COVID-19, then I think you can raise questions. I will, because we are both, all us are learning, this is we are still accumulating our knowledge about this new disease. So because I have some medical background, I may understanding some of the information a little bit better. So in this way, I can explain to you. And
guys, can you mute your audio until you're ready to talk? So Dr. Zhang, can we start with, and I think this is important because there are a lot of people that have Lyme and then they got COVID on top of it, and it becomes this whole kind of total inflammation. And what we talked about last time, even just going forward in this current environment, the importance of the allicin, and maybe you could touch base on that, combined with the circulation P, and then we'll get into the AIM and the Artemisia.
Okay, I think Lyme disease as a basic disease, if we add in the infection of COVID-19, that increase the risk factors. And because Lyme causes immune dysfunction. For people with immune dysfunction, especially immune deterioration, compromise, like CD57 low, and also body's ability producing antibody low. That's very common in Lyme patient, the chronic Lyme patient. And also chronic Lyme also causes autoimmunity, oversensitivity. And oversensitivity can make the new infection, the COVID-19 infection, because the immune system not very stable. It's likely to have a cytokine storm or explosive inflammation. So therefore, these two diseases, if they come together, I think that many people with chronic Lyme disease as a basic sickness, then if we contract with COVID-19, that is made the risk factors increase. So I think that to know both of how to deal with it is important. I think that probably people know that COVID-19, the infection, it is very easy to spread, very contagious, but the morbidity and the mortality is not very high. Only about 20% or less people become seriously sick. And only less than 6% people become critical sick, needs ICU or needs a ventilator. So very important is how to preventing the 80% more of these people, either asymptomatic or very mildly sick without needing hospitalization. How to preventing these asymptomatic and also mildly or moderately sick people, preventing them from developing into serious sickness and critical sickness. That is the most important thing. And that I think from our herbal medicine and from what we have been seeing, the things happening in China, and this we can do a lot of things to protect ourselves and preventing the mild and moderate disease to become a serious and critical sickness. And before we talk about allicin, last time we talked about allicin. Allicin in China, this has been there for more than 42 years. I learned it from my son's sickness, high fever. Now he's 42 years old. And I used it for treating AIDS, especially the AIDS patients' opportunity infection. I have been using it for treating Lyme disease, multiple pathogen co-infection. And recently, there's a study done in China, reported by a Professor Tang Yihong from Jiangnan University of China. Jiang means Yangtze River. Nan is the south. It's a Southern Yangtze River University. And they did, because they were mainly studying to using allicin for treating animals to preventing them to as an alternative for antibiotics. And because this pandemic, they tried to using a very primitive method in Wuhan, and just using smashed garlic, put it onto the spoon, put it into the mouth, not chew, not swallow, just smell the garlic smell. With this very primitive method, they tested in few community in Wuhan, and they find none of these people doing this catch the virus. And then they go back to the university to do the study. They find this smell, the allicin, can combine with the virus's enzyme, which the virus needs for reproducing the new virus replication. So this, the allicin combining with this enzyme stop the replication of the virus. This is why they feel that how can these people just using this very primitive method, they're preventing them from the infection. And also I think that allicin is a very simple and non-toxic method. It would be a very, I think it would be very useful. And then how to preventing the mild and moderate or asymptomatic condition to become a serious sickness. To become serious sickness, there's two mechanisms. First is the endothelial cells of blood vessel and being infected by the virus, which make the blood vessel, the interior wall of the blood vessel become very rough, inflamed, vasculitis, which causes tiny, small blood clots formation, embolus. And when these embolus get together, become thrombosis, and then they stop the sealed, the capillaries networking in the lung, with the lung cannot to exchange the oxygen and the carbohydrate that cause breathing distress. And also when the thrombosis goes to the brain, causes stroke. To the heart, causes heart attack. To the kidney, causes kidney failure. So this is a major pathology. We can using allicin, circulation P to preventing this to happen.
So just to start, it's kind of a no-brainer at this time for everyone to be on the allicin, which is enteric coated. It's really easy to take. It's a proprietary blend from the bulb of the garlic, I think, or with the circulation P. That's kind of just like a no-brainer just to be on that, correct?
Yes, I think that not only it is good for anti-infection prevention, it's a real general health support.
Exactly.
Allicin has a very good benefit for anti-cancer, for cardiovascular function, and lower the viscosity of the blood, make the blood much more liquidized. And it has a lower our body's general pathogen load. Because our body usually we have some pathogen load we don't know. And allicin has a very wide spectrum antibacteria, mycobacteria, fungus, protozoa, and certain virus. Therefore, it can generally lower the pathogen load in the body. That is very beneficial. And the circulation P formula, improving the overall body transportation, open up a more networking of capillaries, provide more blood to all the organs of the body. So general support of general health, it also preventing DIC, diffused intravascular coagulation. That is the main of the pathology of the COVID-19 infection caused the serious disease. And also that, yeah.
No, I just want to just put a caveat here that I recommend everyone as an individual having a consult. However, being on the allicin and the circulation P is safe for everybody, right? We discussed that it is very safe. But I still think that I know there are some people on this call that might also have Lyme or have other history, and that's where Dr. Zane can really kind of pinpoint other methods of treatment. But you're not going to go wrong with the allicin and the circulation P.
Allicin has been used for infants.
But I was going to ask, if I may, what about if you're on a lot of medications for different things?
It is not much like that's a reaction with the medicine. And the only thing that using this circulation P and allicin, if we are on the blood thinner, like Coumadin, and those people may be difficult to using circulation P or allicin because further thinning the blood may sometimes cause interior bleeding. But overall, this will be not, there's no other problems.
So does garlic cause bleeding? If you're on, I'm on a blood thinner, but I've started taking a lot of garlic since I heard you.
That I think it's not so strong.
Okay.
Also that make the blood less sticky, to reduce the viscosity of the blood. But as I mentioned before, the circulation P formula and allicin, they are improving the blood function. The blood is a liquid, but the liquid is an organ. And make the blood much more liquidized inside a blood vessel. It is the blood function. And when the blood goes out of the blood vessel, needs to be coagulated to stop bleeding. that also blood function. It is not passively because the water evaporating cause the blood become dry, become coagulated. The coagulation of the blood outside of the blood vessel is an active action. It is a part of the blood function. So circulation P formula can promoting this function also. It's a two-dimensional. When the blood inside the blood vessel, it's making more liquidized to thinning it. When the blood goes out of the blood vessel, promoting coagulation. So it's not very severe, but for the caution, if people on the Coumadin, on the blood thinner, then we ask people to check the PI and to see whether this how the clotting factors working or not, to see how the just as a precaution.
Would you, if you were having surgery, would you have to stop the allicin or the circulation P?
Circulation P before the surgery, we ask people to stop for 5 days or so.
Okay.
And it can resume after surgery 2 or 3 days. It's promoting healing of the wound.
Oh, that's good.
And because it's bringing more blood to heal the wound. Circulation P formula I've been using for more than 30 years on myself. I take it every day. That make me look younger than my kids.
Well, actually, that's what we were really, the reason we're all here is because you look so young and we all want to look as good as you. But Dr. Zhang, so for people that have not been tested for COVID, but are not feeling well, they should have a consult. But at that time, when would you add the AIM is a Chinese version of a steroid, dexamethasone, with no side effects. But
there's some side effects.
Oh,
For the childbearing age woman,
right.
if it is used for longer than 3 months, can cause menstruation irregularity. So we are, as a precaution for people, for the woman with childbearing age before the menopausal. So we are not using longer than 3 months. For other people, it's okay. It's very benign.
So if someone is having any inflammatory condition, whether it is a joint or allergies, like, would you put them on the AIM, or especially now during this kind of COVID time?
Yes, that this one is a group of glucosides, and they in China is nicknamed as steroids, botanical steroids. It's discovered in 1970s, 1960s. It has very good effects as an alternative for the steroids. As I mentioned last time, last century, in the clinical medicine, we have 2 great discoveries. One is antibiotics, another is steroids. So if we have anti-infection substance, we have anti-inflammation, immune regulation substance, we can treat many diseases. So AI number 3, we have been using for ulcerative colitis, for psoriasis, for rheumatoid arthritis, for systematic lupus, and for Crohn's disease, and for the allergy like skin problem, eczema, or urticaria, and asthma caused by allergy. A very wide spectrum of the usage.
Did you say that you use it for Crohn's disease? It's effective?
Yes.
And how many, do you take one twice a day, or?
That depends on the situation. If the disease is very active, in the active stage, we're using higher dose, 5 capsules a day, 2 in the morning, 1 at the noontime, 2 in the evening. if it's in the not active stage, using 3 times a day. I can tell you a story. I have a patient, he's waiting to cut off the colon because of the ulcerative colitis, and waiting to be hospitalized. During this waiting stage, he called me. He said, anything I can do. And later on, we saved the colon. And he avoided the surgery and also controlled the colitis and ulcerative colitis. So I think this is it is very effective, especially now we can use it for preventing the cytokine storm and explosive inflammation happening in the lung, which is a major pathology of COVID-19, caused the critical sickness.
But if someone has had COVID, then you would put them on this because it would also prevent that possible vasculitis and
Okay, if you need me, call me.
The explosive inflammation and the cytokine storm.
right.
Cytokine like interleukin 2, interleukin 6, and those are the cause the inflammation factors. So using this can preventing it. Because if you have this, then you quickly, and you will be collapsed down to a critical sickness, and that become very dangerous.
So you also mentioned, I'll tell you one thing, someone I knew had very bad systemic poison ivy, and she went on it and it went away in 2 days, but it also makes you feel very good. I don't know, it's very relaxing.
That is because the immune system being disturbed, allergy, making you nervous. Not only just the skin problem, just the allergy. The whole immune system stood up. It make you emotionally, you don't feel stable.
That's amazing.
Yeah.
Okay, I think everybody should be on it now.
Yeah.
But you're right, because if your immune system is inflamed, then your nervous system is activated. And then for me, because I had cancer 15 years ago and I had COVID, and you told me I should be on the Artemisia because we don't want to mess around. But anyone that, again, if you have a consult, but anyone who has had a prior condition at this time, especially if you have COVID, then the Artemisia could be life-saving, right?
Yes, I think that cancer survivors, now many, we have cancer survivors, they went through the oncotherapy, either surgery or chemo or radiation, and all targeted treatment. And after this treatment, the main lesion is removed or destroyed, but there's some of the cancer cell left over there. Because cancer's invasive behavior starting very early. So the main lesion removed, destroyed, but there's some spreading cells still in the body. This we call the minimum residual disease. The minimum residual disease, we cannot using chemo to deal with it because chemo is too toxic. But this minimum residual disease is the foundation of relapse and metastasis. Relapse and metastasis, those cancer are more malignant than the original cancer because this cancer has mutated. So for relapse and metastasis, to preventing it, we have to treat the minimum residual disease. And luckily, the ART-M, the artesunate, it's very benign. It's only promoting cancer cell undergo apoptosis without hurting normal cells. this is very difficult to get, this kind of substance. So this is very good for treating precancerous condition, like a pap smear positive for dysplasia, like the polyps in the ulcerative colitis, like the epithelium, intestine epithelium dysplasia in the stomach. And all those can be prevented. And then preventing the minimum disease, residual disease to become a relapse and metastasis cancer. That way you can use it. It's very useful. And we've been using it for treating many people like liver cancer, because before I was treating hepatitis C, hepatitis B, autoimmune hepatitis, fatty liver, those finally they develop into cirrhosis, then to become a liver cancer. We've been treating many people with liver cancer after oncotherapy, and they keeping them very well and preventing the relapse of metastasis. So I think this is a good thing because cancer is not so, everybody has cancer cells in their body. Autopsy reports when a person 80 years old, like me, 100% has cancer in their body.
Amazing.
Sometimes even not one cancer, maybe several cancers. But only 40% die from cancer. 60% are not died from cancer. So these people, everybody has cancer. We have to preventing them from the cancer precursor to develop into cancer, clinical diagnosable cancer. So we can using this as a prevention. I myself were taking this like 1 month on, 5 months off, because this is a dynamic balance. If we are immune system apprehended, those cancer will not develop into a clinical diagnosable cancer. If your immune system being suppressed and the cancer apprehended, then it will develop into a clinical diagnosable cancer. So I think before we don't have things like artesunate, which is benign, it's selectively against the cancer without hurting normal cells. This is a very good substance. And thanks to the institute at the University of the Washington State University in Seattle, and they did the study, and also the study later on, the National Institute of Cancer, NIC, also did a study. So this is well known, but because this is it's not invented in this country, so there's no patent, no money there. So nobody just advocating it. That is why we use it.
So, Dr. Zhang, you also mentioned if there's anyone on this call that doesn't have COVID, but if you're diabetic, if you're overweight, if you've had cancer or cardiovascular issues, this is a time to go on to actually have a session with Dr. Zhang, but at the very least to go on some of these protocols that we discussed. And I think we're all kind of battling one thing or another, just trying to keep our toxicity level low and our immune system stronger. So I just wanted to open it up for a second. If anyone has any questions, any personal questions, or before we go in a different direction.
I have one. Can you hear me?
Sure. Hi,
Hi,
Thayer.
Dr. Zhang. I'm Thayer Barkley. How are you? I was diagnosed with Lyme disease well over 25 years ago, and I found out I had it by waking up with Bell's palsy. And I don't remember the treatment I have, but I haven't had any treatment since then. But I do notice that I do have a lot of inflammation, have a lot of body aches and things like that. So what would you suggest? I mean, I'm going to do a consultation, but in the interim, before I get to you, with the Circle P and what was the other things called, Barbara?
The allicin.
The
And
allicin.
probably, I'm sure he's going to add some more onto that poo-poo
Right.
club.
And I noticed my body holds a lot of weight, even though I don't eat a lot, but I carry it. So I don't know if that's part of the inflammation or what's going on, but my body feels out of
Well,
balance.
actually, Thayer, if you had Bell's palsy, a good question for Dr. Zhang is also how that could, you don't seem to have it now.
Well, I still have it. Like my right side of my face still droops, like when I'm really tired. So it doesn't move as fast if I get upset.
And
It's still-
actually, her knee is very bad, which the AIM for the knee would be great. So now that I've just diagnosed you, go ahead, Dr. Zhang.
I think that for the disease, different medicine approach, the Chinese medicine approach to the chronic Lyme disease is supporting the good, eliminating the bad,
Okay.
eliminating the evil. And the disease is two sides. One is a pathogen invading the body.
Mhm.
Another is the body to develop disease, which is the soil of the environment, the terrain of the disease. So if we make the body stronger, and the disease, probably the course of the disease, response to the treatment, clinical outcome is different.
Okay.
Like we living in the same environment, many people take exposure. Some people not sick.
Mhm.
Some people just have very mild sickness. Some people very sick.
Mhm.
Why? This is because the determination how disease happen or not, how good to respond to the treatment, how good is the prognosis is determined by the body, determined by the terrain of the disease, not the pathogen. So conventional medicine only focuses on pathogen.
Mhm.
It's wrong.
Right.
We have to focus on the body's immunity, which is the defensive power. General health, a healthy body can heal itself much more effectively. And the Lyme is a very complicated disease, chronic Lyme disease, multiple pathogen co-infection,
Mhm.
not only bacteria like Borrelia, Bartonella bacteria, and the protozoa, Babesia, and the mycoplasma, and also virus. So only using simple way, using antibiotics to suppress the infection cannot solve this complex problem.
Mhm.
Multiple pathogen, multiple body system involvement, multiple pathology, multiple complications, very wide spectrum symptom pattern. This kind of very complex condition, we can only using Chinese medicine's multiple target regulatory treatment.
Okay.
Instead, single target suppressive treatment.
Right.
And the single target suppressive treatment given by the conventional medicine, because they believe they have very strong external intervention. They try to do the job for you.
Mm.
But really, the job can only be done by, by your immunity, your defense, by your general health, under the help of anti-infectious substance.
Okay.
So this is a different philosophy. We believe anti-infection, get rid of infection. This job can only be done by you. We cannot do the job for you.
Right.
Therefore, we have to do anti-infection, immune regulation, general health support, treating the complications, symptomatic treatment. In this way, we can solve the problem. Just using anti-infection alone will not solve the problem. This is a different philosophy. So different philosophy leads to different protocol design and leads to different clinical outcome. So I think that is why we need to combining, integrating Western medicine and Chinese medicine. Chinese medicine provided a very good guideline, the principle. Western medicine provides the scientific facts. What is the pathogen? How does the pathology, pathophysiology in the Lyme disease? What the pharmacology can treat it? That is what we're using to put them together. In this way, we can do much better job than only using antibiotics alone. Mm-hmm. Antibiotics is not, this is a dilemma for the conventional medicine. The Infectious Disease Society of America, they are the main infectious disease society. They have most of infectious disease specialists. They deny chronic Lyme disease. Mm. They think that your lingering problem is so-called post-treatment Lyme syndrome. Mm. That they deny this persistent infection. That's wrong. But they have one thing they said good. Long-term using antibiotics make more harm than good.
That's right.
That's true. Mm-hmm. Another group is called International Lyme and Associated Disease Society. Mm-hmm. And they acknowledge chronic Lyme disease, persistent infection, but they want to using long-term antibiotics. Antibiotics are not designed for long-term use. No. For a few weeks is good, not for months or for years. Months and years cause the flora disturbance in the gut, mm-hmm. cause the fungus overgrow, yeast overgrow, and it is not good for long-term use. But this is a dilemma for the conventional medicine. So that is why we say we need a multiple target regulation instead single target suppression.
Thank you, Dr. Zhang. But Dr. Zhang, I have a question. You recommend B3 to a lot of people. I just wanted to know what you thought about that. And also, what about taking extra zinc, because this virus apparently hijacks the zinc? So can you just talk to us about the B3 and the zinc?
I think that this is also, we think that how to deal with disease. Disease is happening in the body. We have to make the body strong. And the conventional medicine, they isolated the disease from the body. And the Chinese medicine believe the disease part of the body is one of the elements of the disease, the body. So disease part will affect the body will affect the disease part. We cannot isolate the disease from the body. So therefore, we have to make the body strong. And vitamin B3 is also called niacinamide or true niagen, or called NMN. And this is a precursor of NAD+. NAD+ is also called coenzyme 1. Coenzyme 1 is our body's cell organ, mitochondria, used for producing energy for cell functions. So when the cell function getting better, then your whole body function getting better. It also can correct the DNA mistake caused by age, caused by disease, caused by radiation. When the DNA mistake corrected, our body's fundamental biological function improved. It also increased the sensitivity of insulin, make our body's utilization of the energy much more effective. Very important part, especially for senior people, it is slow down aging.
Oh, so that with the circulation P is like a slam dunk.
That's the vitamin B3 and this precursor of NAD+. And the researcher in Harvard, his name is David Sinclair. He's a professor of biochemistry in Harvard. He himself took it for 1 year. His biophysical markers were 10 years younger.
Are you taking it?
I took it for more than 2 years. It made me can working longer hours, can walk longer distance, can swim in longer distance. So this is very good. I can tell you, we introduced it to one of our friends.
Sorry about that.
And we introduced it to one of our friends. She has a stroke. And for 2 years, she cannot read, she cannot write, she cannot pronounce the whole sentence, only a few words. She lost the smell, lost the taste. She cannot walk. And we're using this, she's over 70 years old. And we introduced her to take it. She took it for more than 1 year. Now she can write short notes to us. And she can walking for about 1 hour. Her smell, her taste come back. So I think this is a very good substance. We've been seeing very good effects in elderly people. So for the seniors, this is really very important and a very good substance to take. It is very benign. It also can lower your cholesterol level, lower your triglycerides level. It's protecting your cardiovascular function also.
Do you take 1 a day or 2 a day?
The ability of our body processing the NAD plus precursor is 3,000 milligrams. And vitamin B3 is one of the version is 500 milligrams. So we take one twice a day, is 1,000 milligrams per day, which is way in our body's capability to process it. So I think that this one, but you be careful when you buy the niacinamide.
Yeah.
There's 2 kinds. One kind can cause flashing, which just like allergy-like problem. The whole body turn to red. That's very uncomfortable. So avoiding those versions. Take flashing free, non-flashing version.
But
That's
Dr.
very
Zhang, you're the one, you sell this B3, and that is basically instead of the True Niagen, right? So isn't this your version of the True Niagen?
We carry it is just for convenient for our patient, because this is not our products. So we just, because people, they probably don't know, then we carry it.
But do you also carry True Niagen?
We carry 2 kinds. One is True Niagen, one is niacin.
B3. But how do you know which one to take? Which one do you recommend?
I think these both of them are very inexpensive, no copycats, and they can have very good effects, both of them. So that doesn't matter. It is very inexpensive and also very good. Sometimes not things are very expensive would be good.
Yeah, no, I know. I just don't know which one, like which, do you recommend a different one to a different patient depending the True Niagen?
I think that in order to reduce the financial burden of our patient, we chose a very affordable one.
So nice.
Which are like $15 for 2 or 3 months. So that is, we chose this one because the effect is similar.
Right, exactly. And True Niagen is so expensive. And my last question, and then we'll open it up do you feel though that zinc and vitamin D, they seem to say it's like, what's your viewpoint on that, since they say it's important? I'm curious.
Vitamin D is important for immunity, not only for the osteoporosis or osteopenia. It's helping to contain the calcium. Zinc is also help with our immune function to preventing the virus infection. So those things, I think, if you take a multiple mineral and that just taking the dosage according to the bottle will be enough. And usually the vitamin D3, D, we take 2,000 to 4,000 units per day.
With the K.
Yeah.
So do you also, for people that are having gut issues, which a lot of people have had if they've been on antibiotics or chemo, what do you recommend?
That we're using some of the traditional Chinese medicine. And traditional Chinese medicine, that there's a lot of formula can help the GI system regulatory functions. Another way to improving the GI function, you can rub your stomach and rub stomach clockwise 1 to 200 times. That can also improving your GI function. And so I think that GI function in Chinese medicine being considered very important because it is the nutrition, our nutrition, the source of the nutrition to support our body functions. So very simple way is to using ginger tea. Ginger tea is very good for improving the digestive function, and also lemonade and lemon water. And I read a report. They say why in Israel, people are very rarely got COVID-19 because Israelis, they drink lots of lemon water. And the lemon water has the citric acid can have very good effects to preventing virus infection also. There was a person using the skin of the orange skin plus ginger to make a decoction to drink. Using this way also one way of preventing virus infection.
So it's like nature's pharmacy is everything that you're using to heal us. So before we just end with questions, I just want to give a little summary that it's a very easy, very reasonable protocol for prevention. And then depending on your history or if you feel you have COVID, I would just have this stuff around so you can empower yourselves to be able to treat yourselves and not to panic. That is what's so important. And Dr. Zhang is making everything so available and affordable. I put Elaine's number up there. That's how you book the appointments, but we could open this up to any questions now while we complete the hour. And anybody?
Can you put her number up again?
Yeah, sure. And I mean, we've talked about the vaccine, and Dr. Zhang seems to think it's good, but I certainly wouldn't be the first. I would rather do this protocol first. I don't know, Dr. Zhang, I asked you, my fear is that a lot of people don't know their antibody levels, and the vaccine is supposed to promote antibodies. So I just wonder if some people might get
scared.
Yeah.
You know, vaccine is a protein. So it's a protein to the body it's antigen. It can trigger body's immune reactions. So there's some reaction to the vaccine. It's very normal. Without this reaction, the vaccine won't work. Only this reaction can promoting our body producing antibodies. So I think vaccination is important. That is why we get rid of the smallpox. And without the vaccination, the smallpox were very dangerous. Measles, also with the vaccination. Hepatitis B, we're also using vaccination. Without this vaccination, we cannot control those diseases. So vaccine is important. Don't scare. My whole family, we do this every year for the flu vaccine.
You
I
take
think
the flu
that
vaccine?
is useful.
Really? I thought that it has all of these stuff in it that's not good for you, or
That like polio, if we don't have vaccine, the polio is a big problem, you know? So vaccination is a very good invention of our medical invention that is very important for protect ourselves. So don't scare for vaccination.
but like, isn't the allicin, or isn't all of that enough? Like why? I think it's great you're saying this, because it's not really what I thought you would say, but you would say to do both?
I think that if we have more method to preventing a disease, that is better than just one single method. Yeah,
There
you
you
have
go.
more way to
That's
protect you have more way to treat it. And so that would be a better, we can have the choice, because no treatment 100% effective. In the world, no single method can fit 100% of the population. People are different. Some people response to the treatment are different. So majority may responding well. This is we call the normal distribution. But there's maybe 95% people within the normal distribution. But there's a possibility 1% of people are not respond. That is out of the normal distribution. So I think that is why we have more method, we have better being prepared.
Thank you so much. Does anyone else have any question? Well, thank you so much. I just really encourage everyone to call Elaine. I put her number up there. It's kind of, it's simple. That's what I like. It's scientific and effective, but it's not a whole big, it's not overwhelming. And Dr. Zhang has done so much research.
I think that right now, we don't need to be too panic, because with the knowledge accumulate, with the more knowledge we acquired about this pandemic, we have much better chance than before. So if you want to see some of my notes about learning of the COVID-19, you can watch my blog. My blog is LD, stands for Lyme disease, and AND, and MCM stands for modern Chinese medicine. So LDANDMCM.com. And that I will put all my reading, the reading notes, and on the blog. So I think with time, we have more knowledge about this pandemic, we have better chance. Okay?
Thank you, Dr. Zhang. We all are so incredibly grateful. You're amazing.
Yes, thank you so much. I love listening to you, and I love all the things that you say, because I love medicine. So thank you.
Thank you.
Okay.
Thanks, everybody.
Thank you.
Yeah,
Thank you.
bye-bye.
Bye-bye.
God bless. Thank you.
Thank you, Barbara.
Thanks, guys.
Bye, darling.
Barbara, thank you. Thank you so much.
Love you guys.